When SARS arrived in 2003, we already had some preliminary evidence that coronaviruses were inhibited by treatment with interferon. When you or I are infected with a virus, the very first thing we do is mount an interferon response. Viruses have co-evolved to very specifically encode in their genomes factors to block that interferon production. And that's the reason why, all the more that if you can come in with treatment with interferon, you can override that inhibitory effect. We were able to treat patients in a Toronto hospital who were affected by SARS. Their lungs cleared faster than those who did not receive interferon, and they were quicker to resolve their disease altogether. When we heard about COVID-19, the outbreak in Wuhan in China, I was in touch with colleagues in China, and we were very interested in undertaking an exploratory study at one of the hospitals there to see whether interferon alpha treatment would be effective. What we've demonstrated is that daily treatment with interferon alpha results in an accelerated viral clearance from the upper respiratory tract. And also, we're able to demonstrate that circulating interleukin-6 levels, which spike in COVID-19 cases and are indicative of severe disease, didn't occur on interferon treatment. These findings obviously are exploratory and merit further examination in a randomized controlled trial, which is planned. If you have an index case that's confirmed positive, what we do now is we track all the contacts and ask them to self-isolate, because there is a high probability that a percentage of those will become infected. What one of our trials is going to look at is post-exposure prophylaxis. In other words, taking those contacts, treating them with interferon, and seeing if we can prevent infection altogether or reduce the viral burden and resolve the disease sooner. The opportunity here is that interferons are already clinically approved, so we're repurposing them for another indication. And there are a number of countries around the globe that have manufacturing capability, so I don't think availability is going to be an issue. And we're developing a mode of administration which will be essentially just like an inhaler, where people will be able to use it in their own homes.